Hello, my name is Danette Bell-Vassar, and welcome to my talk on electrocardiogram correlation to cardiac events. So, I am going to be discussing what an electrocardiogram is and how those readings show and signify certain types of major cardiac events. Okay. So, first off, I'm going to talk a little bit about what exactly an ECG or EKG is. Those are the same thing. It's just a matter of whether you're talking about the English spelling or the German spelling. And what an ECG is a diagnostic tool that measures the electrical and mechanical activity of the heart to show whether it is functioning properly in terms of the electrical activity and the related mechanical activity. This is not to be confused with an echocardiogram, which is an ultrasound of the heart and is used for significantly different purposes. Now, generally, you need to be in a doctor's office, hospital to get an ECG, although nowadays with technology, even a smartwatch such as this can give you at least a rough ECG. On this one, if you swipe to the ECG app and put your thumb and forefingers on opposite corners like this for 30 seconds, it will take a reading and be able to give you at least a rough ECG of whether your sinus rhythm is solidly in the normal or abnormal range. So technology has made ECGs easier to come by. So, why might a patient need an ECG? To check their heart rate and rhythm, if they're having chest pain, to assess them for heart attack or angina, um, to assess for tachycardia or bradycardia, which would be an unusually rapid heartbeat in the case of tachycardia, or an unusually slow heartbeat in the case of bradycardia. So this topic is actually pretty timely for me because I just had an ECG a few days ago because of tachycardia. I tested positive for COVID on Saturday morning, and that night I'm sitting in my bed working on my computer, isolating, and all of a sudden my watch goes off telling me that my heart rate is suddenly 150. And being that I hadn't been getting up, taking steps, been active, it warned me that something was going on. So I went to the hospital, and the first thing the triage nurse did was give me an ECG. Luckily, that was able to show everything in my heart was functioning properly, just too fast. It can also help assess for enlargement of the different chambers of the heart, help tell if something is malfunctioning in those areas, and it can even help assess for pericarditis, inflammation of the membrane around the heart. Generally, patients who are going in for heart surgery are always going to get an ECG prior as a baseline assessment before they go in for surgery as well. So now I'm going to talk about what the kind of different parts of the ECG graph reading look like. So, what an ECG does is it reads electrical changes in the skin to get readings of sort of three distinct parts of the heartbeat. As you saw in the previous picture, this involves putting electrodes on the patient's chest and other areas of the body. They generally put a couple of electrodes above the heart, several electrodes below the heart, and some electrodes out on the limbs, either the legs, the arms, upper arms, forearms, so that they can get cross readings of the electrical activity in the skin, which can then be amplified to show them how that electrical activity is occurring in the heart. So the three key parts of the ECG waveform involve the P wave, which is when the atria open. And then you go into the QRS complex, where you've got the activation of the ventricles and they contract. And then you have the T wave, which is the recovery wave of the ventricles. So the key things that these waveforms can show is what's going on with each part of the beat. Are they happening when they should? Are they happening how they should? Is something being skipped? And is it happening at the appropriate speed? That was the key thing for me the other day, is that stuff just wasn't happening at the appropriate speed. So now I'd like to talk about some key cardiac events, such as we're going to start with ventricular fibrillation and what that looks like on your ECG graph. So, ventricular fibrillation is an arrhythmia or irregular heartbeat that is indicated by a sort of chaotic rhythm and rate. The ECG graph is, as you can see, sort of all over the place. You don't have those nice key P, QRS, T waves going on. The ventricles are quivering rather than contracting, so blood is not being pumped properly, and this can lead to sudden cardiac arrest. So, this is generally pretty clear. You see this, again, chaotic um, graph with VFib. Moving on to another potential issue is premature ventricular contraction. This is where the ventricles contract sooner than they should in the process. And this causes sort of a fluttering or skipping a beat feeling. And so what's happening here is that activation of the ventricles in the QRS complex is happening too early. And so it's skipping over the P wave. It's foregoing the P wave. And so we get this deflection of the ST segment and the T wave. And there is then a delay to compensate and try to get things back on track, which is why you've got that skipping a beat feeling, because you've got this delay where sort of nothing is happening while things try to reset. In otherwise asymptomatic individuals, if this happens occasionally, it's can be generally benign, but it can also be pretty indicative of something serious going on as well. And problem with the atrium that can be detected by ECGs are atrial flutter. And this is caused by repeated depolarization of the atrium. So again, it's a sort of fluttering rather than getting a contraction. It's repeatedly contracting rapidly. So it's contracting too fast, out of sync, causing this fluttering. Now there's a couple of key types. Typical atrial flutter is in the right atrium, and atypical is over in the left. And what the EKG will typically show, and these are some different EKGs that you would see with various types of atrial flutter, is that the atrial rate is much faster than the ventricular rate. So the atria are contracting much faster than the ventricle is. So things are out of sync. You generally, what a doctor is going to be looking for is this sort of sawtooth pattern and upright flutter waves that resemble P waves, but those P waves are out of sync. Serious atrial flutter can lead to stroke, dizziness, palpitations, and even death. So, again, heart things are not to be messed with. Another serious heart problem that can be assessed with an ECG is AFib, atrial fibrillation. And this is a irregular rapid heart rhythm caused by improper irregular signaling from all over the atria rather than just the SA node. And so this sort of causes chaos in the atria with rapid, chaotic, out of sync firing of the ventricles. This can cause chest pain, lightheadedness, shortness of breath. And if you look at the AFib ECG reading compared to a normal, you'll see that there's areas that lack P waves, and you have this irregularity of the QRS complex and being generally very fast ventricular rate. So it's going to be compressed. When you've got tachycardia, those waves are going to be coming much closer together. On the flip side, with bradycardia, they're going to be much more spread out. Myocardial infarction or a heart attack is obviously a big concern and something that send a lot of people for an ECG. This is caused by lack of oxygen to parts of the blood due to blocked blood flow, which can cause damage and cell death and in parts of the heart, and irreparable damage can happen in as little as 30 minutes. This can be caused by buildup of plaque in the arteries, blocking blood flow coming into the heart. And so typically what you're going to see in the ECG is elevated ST segments. You're going to see higher spikes and some inversion of the T waves. And so the spikes especially are going to be of concern to a doctor reading this and signal a myocardial infarction, lack of blood flow. There are several other types of ECG readings that you might get that could indicate things like blockages. We see here in the third line, we see that lack of the QRS complex here for a number of beats. ECG readings can also indicate if previous myocardial infarctions have occurred. You'll see specific patterns of on the ECG if someone has had previous heart attacks. Typically, you could get certain readings for ventricular hypertrophy, for example. There are a number of heart issues that can be assessed with the ECG. So this is a really key tool for assessing the health of someone's heart, which I, for one, especially recently, I'm really glad that we have. And I hope this talk was illuminating. These are my references. The citations for each of the images that I used are on the individual slides. And I hope you enjoyed.